Did you know that a blood clot in your leg can travel up to your lungs and kill you within hours? Yes, this is a deep vein thrombosis, and in this video, I cover how we can easily spot it and prevent this from happening. Hello everyone, welcome back to the channel. In today's video, we will be looking at deep vein thrombosis, popularly referred to as DVT in the workplace. What is a deep vein thrombosis? Now, a deep vein thrombosis is the formation of a blood clot or a thrombus in the deep veins, often found in the lower extremities. DVTs can also happen in your upper extremities, but are more likely to be seen in the lower extremities. Now, let us look at the veins that are most susceptible to DVTs. Now, it has to be a deep vein, and some of the common sites are the veins of the calf. So your posterior tibial veins, your peroneal veins, and your soleal sinuses. All these veins are found in the calf. Now you have your popliteal, that is the vein right behind your knee, and then you can also have your femoral vein, that is the veins in your thighs. Now the iliac veins, that's the veins in the pelvis, can also be a site where DVT easily forms, especially after hip replacement surgery. Now, in the upper extremities, these are less common, but you can have some DVTs in your subclavian or your axillary veins. These are usually associated with when you have central venous catheters or pacemakers inserted. Now, in order to understand and quickly spot a DVT, there is something we call the Werkhouse triad. Now, a triad means that there is three different things that come together. So in this triad, when you see these three things, or when these three things are available or present in the patient, they are at an increased risk of developing a DVT. Now, the first one is venous stasis. Now, venous stasis is where you don't have venous blood flowing back swiftly to the heart. Now, once your blood is static or your blood doesn't flow well, it increases your risk of having a clot formation. And so things like immobility, long travels, surgery, and heart failure, most likely left-sided heart failure, are things that can predispose you to venous stasis. And once this is present, there is always the aim to try and mobilize the patient to try and prevent this, even if it's passive range of motion exercises. Also, we've got endothelial injury. So things like trauma and surgery and you having central lines put in can cause injury to the endothelium. And then when this happens, it increases your risk of having a clot. The third thing is a state of hypercoagulability. So there are certain states that when you are in, it increases your chances of having clots. So for instance, pregnancy, it comes with reduced movement. So in pregnancy, it's usually the third trimester where you have a reduced movement. Some cancers, estrogen therapy, and some clotting disorders can give you an increased risk of a DVT because in that state you are hypercoagulable. That means that your blood can clot very easily. Now, having come away from the Werkhouse triad, we want to look at some of the risk factors. So these things, you would find their space in one of the triads. And the first one is prolonged immobility. Now, your patients who have prolonged bed rest or have come from a long flight, because of the reduced movement, they have the risk of developing DVTs. Now, some post-op patients, so those who have had orthopedic surgery especially, and then ones that goes to the pelvic area, they are at risk of increased DVT formation. Also, pregnancy and postpartum. Now, the reason why pregnancy and postpartum make it onto this list is that usually in the third trimester, there is reduced activity, reduced movement, as well as the early days postpartum. And that's where you are at increased risk of developing a DVT. Some hormone therapies, like oral contraception, can also increase your risk for DVTs. What this does is that it causes venous stasis, and so you can have DVTs from that. Now, obesity, smoking, history of a DVT means that you are likely going to develop another one. Also, some clotting disorders and cancers can increase your risk for DVT. How do we diagnose a DVT? Now, clinical assessment is always important. So you want to do your physical examination, you want to do some history taking, and then look at the symptoms the patient is presented with. Why are we saying physical examination? So things like a swollen leg that is red, so you have some erythema, the site is hot, that would show you that a patient may have developed a DVT. Now, there's also a test called the D-dimer testing. So now the D-dimer is actually the substance that is released when the clot dissolves. So if you have a DVT and you do your D-dimer test, it will be elevated. Okay, so a negative D-dimer test means that you don't have a DVT, but when you have a positive D-dimer, then it could show you that you may probably have a DVT. Now, the next thing will be imaging. I think this is the gold standard, the duplex ultrasound. So what you do is just to scan the arm or the leg, in this case the leg, because that's the most common place for a DVT. So you want to scan the leg, and then you can see the clot formation within the veins. Now, there are other things like the venogram, the magnetic resonance venography, and CT angiogram. These things are not routinely used to diagnose DVT. So the ultrasound, which is a non-invasive procedure, when a gel is used and then the ultrasound probe is placed on the foot to try and assess the veins. This is the gold standard when it comes to diagnosing a DVT. Now, DVTs are usually not very harmful until you have a clot breakaway, moving up circulation into the right side and being pumped into the lungs, where you get what we call the pulmonary embolism. Now, this is what is likely going to kill your patient. It's usually characterized by a sudden shortness of breath, chest pain, and tachycardia. There's also the post-thrombotic syndrome, where you have chronic leg pain, swelling, and skin discoloration. And in some severe cases, you may have ulcers of the leg. So what to note is that the clot breaking away, moving up into circulation and getting into your lungs is what we want to avoid. And that's why we need to spot DVTs early so that treatment can be given. Now, let's look at some nursing management and interventions. Now, as a nurse, the paramount thing for you to do is to try and prevent a DVT. So one of the first things you can do is early mobilization after surgery. We mentioned that venous stasis is one of the things that can cause a DVT. So you want to mobilize your patient early enough after surgery. Usually, you would think that, oh, after a major surgery, my patient should at least have some rest before, but we want to prevent things that can be catastrophic. So we want to early mobilize after surgery. Now, do some leg exercises for your immobile patient. So you want to do passive range of motion exercises in bed. Now, you can use the sequential compression devices or the TED stockings. So TED stockings put on the leg gives you some compression, and the TED stockings, what it does is that from time to time, it just massages the leg to try and encourage blood flow back into the heart. Now, you want to ensure adequate hydration. The reason we want to adequately hydrate our patient is to prevent stasis. When the blood is thicker, it takes longer for it to move around the system. And so when you are hydrated enough, you have blood very thin, and then it can't flow throughout the system. And then one of the things you also want to avoid doing is crossing your legs and also sitting for long periods. That's why people who sit on a long flight are at risk for DVT, because blood doesn't get the chance to go up as it should. Now, if DVT is confirmed, what then do we do? So initially, you want to just encourage some rest. This is to prevent an embolus. So you don't want the thing to break away and go into the lung. So initially, bed rest, and then you go on to your anticoagulation therapy. Now you can use heparin, warfarin, or your low molecular weight heparins like enoxaparin. Now, you would see that with heparin IV, you need to monitor your APTTs, and you're looking between 1.5 to 2.5 therapeutic dosing. And then warfarin, you're looking for INRs between 2 and 3. Now, on your low molecular weight heparins like enoxaparin, clexane, you don't need routine lab monitoring for that. You also want to monitor for signs of bleeding. So in the gums, your urine, your stool, you're looking for signs of easy bleeding. The reason for that is that your patient is on an anticoagulation therapy to try and dissolve the clot. And so you want to monitor these signs. It could be that they are now bleeding by virtue of you giving them an anticoagulant. Avoid massaging the affected limb. This is to prevent the clot from breaking and then traveling up into circulation into your lungs to cause a pulmonary embolism. And then slightly elevate the legs and avoid a sharp bend in the leg, because that's like more like crossing the legs, isn't it? So you don't want to bend the leg sharply, but you want to slightly elevate it to try and encourage venous return as well. Now, as a nurse, your patient is on anticoagulation therapy. What are some of the teachings you should be doing? The first thing is use soft toothbrushes and electric razors. Avoid using blades that could easily cause cuts that can bleed. You also want to report for signs of bleeding. Do you have black tarry stools? Do you have hematuria? When you brush, is your gum bleeding? Encourage them to report these things. Also, avoid NSAIDs and aspirins unless it's prescribed. Some people would have to be on regular aspirin and things like that. So if you can avoid it, avoid it. If your patient is on such, raise it with the doctor in the bed space. Can we do something else? Can we hold this for this period whilst he's on this, or do we need to continue? And then if we do, then you have to monitor for signs of bleeding. Now you also want to give vitamin K or keep consistency with leafy green veggies on warfarin, and then you need to regularly monitor your INRs, which are your clotting and your bleeding factors. Now, here are my quick tips to take away from today's lesson. We've been looking at deep vein thrombosis, a DVT, which is a clot forming in the deep veins, especially in the calves and the lower extremities. So priority is that we want to prevent pulmonary embolism. So what you want to do is monitor for signs of shortness of breath, increased fatigue, tachycardia, things like that could show you that your patient is probably having a pulmonary embolism. You also want to avoid massaging the calf and then apply a pillow under the knee and not bend the leg, like I mentioned earlier. You need your SCDs and your TEDs. Now, if there's DVT present in the leg, then you don't want to be putting these devices on, because what you risk is a clot breaking away and then traveling up into the lungs. Now, if you're on heparin, you need to know your antidote and have it readily available. That is protamine sulfate. It's the antidote for heparin. And then you need vitamin K available if you are on warfarin. I believe this helped, and then giving you some information about DVTs. Like the video, share, and subscribe to the channel for more videos like this. Until then, I'll see you in the next video.